Bula Vinaka and welcome to Bula Wellness. I'm your host, Dr. Alisha Sahu Khan, the Head of Health Protection with the Ministry of Health and Medical Services. My work is in communicable disease. You may also know it as infectious diseases, which are simply diseases that are caused by organisms like bacteria and viruses, which are spread from person to person, between animals and people, or through the environment. Before the middle of the last century, infectious diseases caused the most deaths worldwide. The average person, including in Fiji, was not expected to live more than 50 years. But this all changed with the invention of vaccines, antibiotics, and with improvements to the access to clean water, sanitation, and hygiene. So today, people are living longer. The average life expectancy in Fiji is 68 years. But while deaths from communicable diseases have decreased, we have seen non-communicable diseases, or NCDs, surge globally, including in Fiji. So today we start our series on non-communicable diseases, or NCDs. When we talk about NCDs, we are talking about all diseases or health events that cannot be spread person to person, animal to person, or through the environment. But we will focus more on what are known as the lifestyle diseases. Diseases that are influenced by lifestyle factors, example, your diet. So today we are talking about diabetes. Diabetes is one of the top causes of death in Fiji, and the complications of the diseases are very severe, and they include kidney failure, diabetic foot sepsis, diabetic retinopathy, heart disease, and stroke. This is just the first episode that we'll dedicate to diabetes. And in this first episode, we will be talking to Dr. Rajeshwar Sharma from the Ministry of Health's Suva Diabetic Hub, and showing you the work that is done at the hub to help people with diabetes. But first, let's see what some of you, the members of the public, know about diabetes.
Matini suka untuk mati deo waktu nakakanilukan. So nakakan sa tumpos ting may nanda puno sa rumay udurwan naman ko. Sa may baka puno ting matini suka.
Diabetes is a type of non-communicable disease. It is a type of illness that causes the lack of exercise, eating unhealthy foods.
Nakangau kilati kumpulatan mati ni suka na ni mati sureti na buku ni kana buku Italia na kanda kani mai one store.
People get diabetes by lacking of exercise, eating unhealthy foods.
Kiloya umimbulatan mati ni suka ko endo na mati e baka puno nakakan. Sa taronga ti sa saratu kuna ti ko ira ni kakana e lukana ti ko lo mal ko si puli mai nesto. Ni baka puno na mati ni suka.
Sindo nakakana ministro wana nulu sina bika sara bunting turisto.
Kalau takabi yau si takava talendo ke bakasi ni karono ko pinako ko na nonong. Dua nonakan, nonangun wai si pungatal naka karena biyo nakato ko mitako makina nangon. Kena boleh pun takabi ko na mati so ko sara mi tiga bubi ko na boleh nonang gangarang.
You can prevent diabetes by exercise your body every day, eating healthy food.
Bike mami na tuwa na kore na gali, kama misaka na tunga mo inetite, kama mi abawala bo lebu ni bila ko yaki, ruo tolu na kilomita anto na singa, tombalean na tombale mai, yapa ko tagatuna ni mami Bula.
Our guest today is Dr. Rajeshwar Sharma from the Diabetic Hub in Suva. Welcome, Dr. Sharma.
Bula, Dr. Alisha. Bula to everybody.
So first of all, what is diabetes?
Okay, to understand diabetes, we have to understand the story of glucose. What is glucose? Like the cars need fuel, we have petrol for the car, we also need fuel. Our fuel is glucose. Now where does glucose come from? Glucose comes from the food we eat, plus our body makes this glucose. Foods such as carbohydrates, the starchy and sugary foods, are digested to glucose and it's taken to the blood. Now from the blood, it has to go into the body proper. The body is divided into small parts, which we call cells. They can be imagined like rooms. So to enter a room, you have to go through a door and you need a key. The key here is insulin. Now for glucose to enter the cell from the blood, we need keys. The keys here in our body is insulin. If you don't have enough insulin, what happens? The glucose gets stuck in the blood vessel. So when you go to the hospital, the nurse or the doctor test, they say, oh, your glucose is very high and you have diabetes.
Okay, so when you talk about glucose, that's really your food that has broken down and is now in your bloodstream. And for your body to use the food, it needs to come out of your bloodstream and go into the tissues of your body to provide energy. That's correct?
Yes, doctor.
Okay, so with diabetes, that gets blocked. So instead of going into your body tissues, your muscles, for example, it stays and keeps going around in your blood.
Yes.
That's right. Okay. So what is the effect of that on the body? Why is that bad?
Okay. Let's take a banana, a sweet thing. Okay, glucose is very sweet. So we put a banana on the cupboard, in the cupboard for 3 weeks. What will happen? It will rot away. Anything sweet except honey will rot away. So all fruits, even food, it rots away. So too much glucose in the blood vessel will start rotting or damaging the blood vessels. Now where do we have blood vessels? We have blood vessels all our body, our eyes, our brain, our heart, our kidney, liver, feet. So if we have blood vessel damage in our eyes, we will lose vision and we can get blinded. Same thing for the heart. We can get blood vessel damage in the heart. Blood vessel damage in the heart leads to heart attacks. Kidney leads to kidney failure. In the feet, the infection will not heal and will end up with amputation. So you can see how damaging diabetes can be, because it can damage any part of the body.
Okay. Thank you, doctor. We will go to a quick break and then come back to talk more about diabetes and who exactly is most at risk of getting diabetes. Welcome back. You're watching Bula Wellness on FBC TV. We have Dr. Rajesh Sharma from the National Diabetes Center, and we are talking about diabetes. So, Dr. Sharma, just before we went to the break, you were talking to us about how diabetes happens in the body, but who is most at risk of getting diabetes and why?
Okay, in Fiji, diabetes is such a common disease. Almost everybody is at risk. People who are older used to have more diabetes in the older people. Now younger kids are having diabetes. Okay. Now, diabetes is happening because of this rapid urbanization. With this rapid urbanization, because people are now living in towns and cities. In the past, we used to have a relaxed life. People used to work very hard on their farms. The food they ate was not stored in their body. Now the reverse has happened. We are living in a busy lifestyle. We've got a lot of stress. We are eating the wrong type of food, and we are not being very active. So these are the lifestyle factors which cause diabetes.
Okay. And I'm right in saying that there are two types of diabetes and the causes are actually quite different and they
Yes.
affect different people?
Yes, doc. Type 1 is usually in the smaller children. That is because you don't have any insulin at all. There is damage to your pancreas. There is no insulin production at all. Type 2 is usually in the older people, teenagers and older people, and this is caused by a little bit lack of insulin. And remember the door analogy I have given earlier? It happens when the lock is not working, the lock of the cells are not working, and the door remains shut. We call that technically peripheral resistance.
Okay. Why are there so many people with diabetes now compared to previous decades?
I did mention earlier we have rapid urbanization. People are moving towards the cities and towns. The lifestyle has changed dramatically, and because of these lifestyle changes, the stresses with the rush of life. You study a urban person, a person living in a semi-urban area. Their life is rushed. They have to go through the traffic, be in the traffic jam for hours and hours, rush to work, and to make ends meet, it's much harder. All these and they don't have time for exercise, they don't have time for leisure. So all these are causing stress in the body and later leading to NCDs, not only diabetes, high blood pressure and heart diseases and the rest.
And of course diet would play a very important role in this. We have access to a lot more food now, but would you say the quality of the food is a bit different?
Yes, more unhealthy food.
Yeah. Okay. What are the complications of diabetes, and why do people get them, and how do people actually die from diabetes?
Okay. There are two types of complications in diabetes. Short term, if your glucose is very high in the blood, it can cause dehydration, because when glucose is very high, you'll go and pass a lot of urine. You get dehydrated easily, and then your body becomes acidic. That is called diabetic ketoacidosis. And this, because of this high glucose level, you can also be predisposed for infection. Ordinarily, if a person gets an infection, like a viral infection or pneumonia, they will heal. They will heal faster than a diabetic. Diabetes, because of high glucose level, the immunity is lowered. They can get very seriously sick from the infection itself. So, and they can die. They can die with acidosis, and they can die with infection, the blood poisoning from infection. On a longer term, diabetes will damage all parts of your body because it damages the blood vessel. So damage of the blood vessels of the eye can cause decreased vision and even blindness. Damaged blood vessels of the brain can cause strokes, where you lose part of your limb, you can't able to walk well. Damage of the blood vessel of the heart can lead to heart attacks, and you can die from heart attacks. Damages to the blood vessels of the kidneys can lead to kidney failure, and you can have a miserable, difficult life with kidney failure and also die with kidney failure. Damages to the blood vessel of the feet will lead to reduced blood supply of the feet. So if you have a small infection, it will not heal, it will just get bigger and bigger, and whole behold, all the doctor can do is to remove your leg and amputate it. So you can see in diabetes, over a longer period of time, if it's not controlled, it will damage all parts of your body.
Okay. So speaking of damage to your feet, during this episode we will show a bit of footage from where you work at the Suva Diabetes Hub. So could you please tell me, what are you doing at the hub? And I know this is a center that's established by the Ministry of Health. So what is the hub doing? What is the Ministry of Health doing to address this huge problem of diabetes in our country?
Okay, there are 3 hubs in Fiji. One is in Suva, one is in Lautoka for the west, and one is in Lambasa for the north. There are 2 clinics in the hub. One is the educational clinic and one is the food care clinic. In the educational clinic, our main aim is to educate the patient to control their diabetes. We have a team there, we have a dietitian, we have stress counselors, nurse educators, and we have doctors. So when you go to the hub and you have diabetes, the team will educate how will you look after yourself, how will you control your diabetes, what will you eat, how will you exercise, and then the doctor will prescribe you medication. Together we have a food care clinic. The nurse there or the nurse educator will also examine your feet and tell you how you should look after the feet. We also look after ulcers, foot ulcers. These are long sores which stay there for a long time, and we help people how to take care of the ulcers. So it's, in short, it's an educational center. So in Fiji, the government has 3 diabetic hubs. However, the government has also health faculties all over Fiji, and every doctor in Fiji is able to do diabetic management, so they can see diabetic patients. We have educational programs for nurses and doctors that we cater for, we teach them, we upskill them.
Yep. Okay. Thank you very much, Dr. Rajesh. What would you advise the public in order, first of all, to prevent yourself getting diabetes in the first place? And if you have diabetes, what can you do to prevent the complications?
Okay, there are a few things you can do. In short, in Ministry of Health, we say we have SNAPs. So if you are smoking or abusing your body with too much alcohol, please think twice. Stop smoking if you need to. Reduce your alcohol, drink sensibly. For nutrition, You weigh yourself, look yourself into the mirror. Are you overweight? Do you have too much fat on you? You have to normalize your fat, reduce weight, get fit. Okay, start an exercise program. Everybody should exercise regularly. If you do need a help from a medical person, dietitian for example, or a doctor, you have yourself checked where you are. A dietitian can advise you what to eat, how you can reduce weight sensibly. Okay, and you should also manage your stress. Stress has a big impact in person's life in regards to diabetes. Stress can lead to diabetes. It can make your diabetes worse. So see a stress counselor if you can, or a medical doctor if necessary.
Okay. So if anyone wants to get checked for diabetes, this is available not just at the Diabetes Hub, at all health facilities that are run by the Ministry of Health?
Yes, Doc. We can get checked for diabetes in any medical center, health center, hospital, diabetic hub, or even your private GP. You can get yourself checked.
Thank you very much, Dr. Rajeshwar.
My name is Kritesh Kumar. I'm 35 years old. When I got diabetes, I was only 25. So it's now 10 years I got diabetes. In the beginning, I didn't know that I got diabetes because everything was going well, good. After 2-3 years, when my body started to shrink a bit, because before I used to wear 4XL shirt, it was quite big size. So I went for my checkup. They checked and they said, okay, I got diabetes. But in 2016, my first big toe of my right leg, it was taken out. So from there, I realized what is diabetes now. You can't cure it. So I started to getting on diet, but the only problem was that I have to continue walking. So just because of that, my toe is not getting well. So in this last year, 2017 again, I got another operation on my left toe, left leg. So it got infected. I was walking in a small piece of iron went in. So for another 6 months I was at home doing nothing. So when you get diabetes, if you don't control it and if you're not aware of it, it's very risky in the life. Very struggle too. Actually, in the beginning, I used to take plenty sweets, drink juice, beer, smoke. Because that was my young time when I left school. When I started working, workmates, every week party and everything. So that was the main thing. In the beginning, I didn't know about diabetes. So when it came to me, then I realized, this was all that happened. Actually, when I was 25, I came to know that I got diabetes. So that time it wasn't that risky. It was just normal diabetes. I was taking my tablets and everything. But that time I didn't take care of it very well. So I was just, 10 times I drink.
You didn't take it seriously?
Yeah, I didn't take it seriously. So most of the time I drink beer. But on 2016 when my Vesto went off, then that's the time I realized, oh no.
It came to you that it was serious?
Yeah, it is serious. Actually, it's very hard because in my family, it's me and my wife, my daughter. So my parents, they got divorced when I was a kid. So my parents' support is a little bit, and my wife's mother also passed away when she was a little girl. So my mother, she is helping us a bit. But now my wife just got a job just yesterday. So she just started working. So whatever help I get from my mom, that's it. Actually, now I don't take most meat and all this, mostly vegetables, soup, and drink lot of water. This is the main thing, because most of the thing is, if you drink lot of water, everything gets clear out. They say if you pass urine, so all that fats inside your body, it comes out with it. So the more you drink water, it's more better.
So before, when you never, before you didn't drink a lot
No,
of water?
before I used to drink a lot of beer. That's the main problem. Yeah. Try to check yourself every year that you had any kind of sickness or anything. Because if you think, oh no, I am fit and fine, but one day when you wanna run to the hospital, then you wanna, oh no, it's too late. Control your diet. Have plenty vegetables, fruits, that will help you. Yeah, they are helping me a lot. I get my medication free, and every 2 weeks I come for my dressing. They clean up my room nicely. They give me dressing applies.
I think I got diabetes in 2003. I got start diabetes, but that time I don't know anything about diabetes. Then I was working in South System in Nambua. I was machinist and a forklift driver. And from there, I was wearing safety. You know, in Kimbai we have to wear the safety boot. And at the side of my toe, the blister came. Then from there I went to doctor in Balelevu. They gave me 2 injections and they told me to come after 2 days. After 2 days I went there and my toe was very bad. Then they told me to go to CWN Sugar, and I went to see Dr. Rajesh there, diabetes center. I was there. I went there, then they told me, oh, it's too late. We can't help. And they admit me in the hospital. After 2 days, they cut my toe. Then they said, I was admitted there. Then they said, after 1 week, we'll see what happened. And they cut another finger after 1 week. Then after another week, they cut another finger. Then it was almost from here to here, they cut. They cut my leg and they told me, okay, we'll try to stop from there. But no. Then they said, okay, they cut it from here. When they cut it from here, then they said, oh, your blood is not going down. Then from there, they told me, okay, we'll have to cut it from here. If not, we'll cut it from here. Then they cut it from here. And then I was in hospital about 3 months. Every day, in the morning or afternoon, you have to train about half an hour. And little bit walk on the road. Then my son, he brought
Your fitness?
the fitness, not very heavy one, not very heavy weight, but about 10 kg or 15 kg like that. Then I have to train every day to keep my, because sometimes my hand was numb and the leg. From that exercise, it's normal now. I can't feel anything. I mean, just like before I feel lazy, don't want to walk, just want to sleep. But now it's okay. From when my leg cut, I was already 55. I was retired, right? But I can do the job. I can, all these blocks, me and my wife, we put the block and I extend another 2 rooms at the back. It's nearly complete, we're painting it. Then, because before, I was a carpenter. I was a qualified carpenter. And I know what to do. All my job in my house, I'm doing myself. I don't have to bring, only I have to take one labor who can help me, that's all. My advice is, if you got just myself, I got diabetes about more than 10, 12 years. But if you want to work, you can do your best. And if you're gonna stay home, feel lazy, sleep, you can't do anything. But myself, from when my leg cut, from that time I know what to do. If you want to long more, yes, you have to work. You have to sweat out. You have to do something. Otherwise, no. If you're sleeping home, doing nothing, that's finish. The main thing is work, doing exercise is the main thing. And control your food. That's the main thing. If you eat more, feel lazy. That's my advice.
Unfortunately, time has caught up with us again, and this brings us to the end of the episode of Bula Wellness. I hope you've enjoyed the program and learned a few things that could change and even save your life and those of whom you love. If you have inquiries about the show or today's topic, like or contact us on Facebook, Bula Wellness FBC TV, or write to us at bulawellness@fbc.com.fj. Make sure to join us again the same time next week for our next episode. Until then, good night.